My name is Erika. I am a first-generation Paraguayan American. Both my parents were born and raised in Encarnacion, Paraguay. My dad later became a doctor, and my mom worked alongside him in his private practice. I spoke Spanish before I spoke English and learned at around age 4. I went to Catholic school from kindergarten to 3rd grade. Here's a picture. There's my mom and dad, my brother and sister, and that's me in the middle on my kindergarten graduation. From a very young age, I can remember being a hypersensitive child. Things affected me differently than they did other people, and I learned how to cover up those emotions at a very early age. At that age, I remember wanting to be a nun, just like my teachers in Catholic school. I had no idea I would grow up to be a person in recovery from drugs and alcohol, otherwise known as substance use disorder. Or that fast forward to 2009, I would find myself sitting in the back of a police car, handcuffed, and on my way to a psychiatric hospital in Dallas, Texas. I had no idea that I would be treated like a criminal for calling a suicide hotline because I didn't know how to continue living, and I also didn't want to die. I had no idea that I would be discharged that same day with no aftercare plan, and the only follow-up I would receive would be a medical bill in the mail. I had some amazingly traumatic, brutally transformative, life-changing, unnecessary, yet totally necessary experiences that led me to find life and purpose through my recovery. I'm always happy to say my sobriety date, which is October the 3rd, 2015. I have never had a drink or a drug since that day. Also since that day, I graduated with a bachelor's in human services and became a drug and alcohol counselor. But my biggest achievement was meeting and marrying my husband, Frank, who is also in recovery and shares the same passion as I do for helping others. Together, we created a grassroots nonprofit organization called We Are Those People, dedicated to changing the narrative of addiction recovery, mental health, and suicide prevention. We advocate for change, spread hope, and raise awareness through photos and film, emphasizing the positives, our accomplishments, our creative talents, and the humanity that lies within us all. Before I get into how we advocate for change, I would like to go over some things that we've learned about addiction. Addiction is defined as a treatable, chronic medical disease involving complex interactions among brain circuits, genetics, environment, and a person's life experiences. A person with addiction uses substances or engages in behaviors which become compulsive and oftentimes continue using despite the harmful consequences. Over 20 million Americans suffer from substance use disorder, and only 10% of that population will receive proper treatment. On average, drug overdoses kill 192 Americans a day. Unfortunately, there are many barriers to treatment. If a person is uninsured or has inadequate insurance, they may be put on a long waiting list, or they may be told to call a state-funded hospital to see if there is a bed available on a daily basis. Oftentimes, insurance companies don't pay for long-term treatment. Many people will never seek help, and they will suffer in silence. I have learned that addiction does not discriminate. It doesn't matter what color your skin is, what ethnicity you are, your gender, or your socioeconomic status. It could be your mother, father, brother, sister, child. In my case, I was the only person in my immediate family that struggled with addiction. As a result of these statistics, we have found that there are more and more conversations happening within families, communities, and legislators. There is a documentary coming out in the fall/winter of 2020 called People Like You, directed by award-winning film director Andy Capper, which centers around the drug epidemic in the United States and focuses on a mother and her son as he struggles and goes in and out of treatment. It also touches on the opioid epidemic, and you see people who are actually suffering from substance use disorder, their families, and the people who work within the treatment industry. It also calls attention to a petition called Anthony's Act, which was created in the name of Anthony Fiore, a young man in Philadelphia who died under such circumstances. Ex-Congressman Patrick Kennedy offers some possible solutions to the epidemic, and he says that we need a complete overhaul of the medical system and the way that we view mental health and addiction. I believe that information, education, and knowledge are the key elements to initiating that change. I believe that if you get to know people who have actually experienced addiction and overcome, that we can begin to make a change. Lonnie Peterson, a professional storyteller and a psychologist, wrote an article called "The Science Behind the Art of Storytelling." She says that scientists are discovering that there are chemicals that are released in our brains like cortisol, dopamine, and oxytocin, and these are chemicals that are released when we're being told a story. Storytelling is essential if you are trying to teach, engage, inspire, or learn about a subject. Our nonprofit, We Are Those People, is a platform and a safe space for people in recovery to tell their stories. We not only heal ourselves, but we inspire others. We talk about all pathways to recovery, and our families tell their stories as well. Storytelling helps us to learn the art of listening. It helps us to connect with each other and to validate each other's experience, knowing that everybody has a story to tell. Coincidentally, our first story was featured in February. In March, the shelter-at-home shutdown due to COVID took place, and our nonprofit really took off. For example, we received a message from a friend of ours in Louisiana who was a paramedic and who said that her job was becoming very stressful, especially because of COVID, and that reading our stories was really inspiring her and helping her to get through her job. We also received a message all the way in Australia from a fellow person in recovery who said that he had just celebrated 3 years of recovery. We ended up asking him to share his story, and we featured his story on our platform as well. We had another message from a person who was struggling with addiction. He said, "I'm in active addiction, and I'm not able to go to my normal meetings, and I feel like I can connect when I'm able to read some of these stories that are on your website." And then we had a message from one of our featured stories, Jenny, who said, "Thank you so much for this opportunity. It was a challenge to write my story, but it was a good challenge, and thank you so much for this opportunity." When I got sober in 2015, I made a promise that if I was to survive this recovery, I would dedicate my life to making a change. And here I am, standing, giving a TED Talk on a subject I had no idea would impact my life so deeply. You see, my story is not that unique. There are millions of Americans of Americans living with substance use disorder and in recovery, and that's exactly why we should be sharing our stories. I would like to leave you with a few thoughts. If you are a person in recovery, or you have been affected by addiction in some way, whether it's through a family member or a loved one, I want to encourage you to share your stories. I want to encourage you to be more open-minded and extend some compassion. If you are in need of help, I encourage you to reach out. There are so many resources out there, and there are so many people who genuinely care and want to help. We cannot and should not continue to be silent when our brothers and sisters are dying. I urge you to be more open-minded and extend some compassion. Let's normalize mental health. We should all have access to good treatment. Mental health checkups should be as regular as medical checkups. We should never have to reach a stage 4 mental health crisis where suicide seems like the best option. We've been silent long enough. It's time to speak up, share your stories. We see you, we hear you, we welcome you, because we are those people.